Over the last few years, the world has gotten crazier and crazier. There's so much darkness and corruption in all areas of our society, but specifically in the healthcare system. The people in charge want to make it seem like they're some sort of heroes leading us to a better future, when in reality, they are getting rich and people are dying. But they're trying to control the narrative. So they are working around the clock to convince you that they are the good guys. But enough is enough. The tables are turning. The tide is changing, and we will no longer listen to their lies. Our society is broken. Our government is broken, and our healthcare system is broken. We can no longer trust our hospitals. My husband Tony was killed because of hospital protocols that put the dollar before the person. In 2021, I decided to make a film to tell our story and unmask the truth behind the deadly hospital protocols. But the thing is my husband isn't the only victim. People have reached out to me with story after story about how the healthcare system has failed them. So I want to continue to uncover the truth. It might seem like a hopeless fight, but I believe now more than ever it's time to stand. I don't know where this road will take me. I don't know if they will listen. I don't know if this will lead to change. But I have to try. There are so many people who are making a killing off of hospital protocols, and it's time to dig in deeper and ask some hard questions. Since the first film, we've had an overwhelming response of people reaching out with similar stories. I've had individuals who lost loved ones reach out to me and share their story. I've even had many nurses speak up and tell me how they saw the corruption firsthand. I've gone to countless rallies and hospital board meetings. I've done interview after interview to spread the word. I've even talked with mayors and sheriffs, attorneys, and doctors to see if they could give me some answers. And so far, the main response is to push the blame and avoid taking ownership for what has happened. I think the big question we have to answer is, how did we get here in the first place? There's a nurse from Pennsylvania named Aslan who got to see the corruption up close and personal. She emailed me and shared how she would like a chance to talk about what she saw and what's going on in the medical field. So I'm curious to see what she has to say. Oh, I'm so glad to meet you finally.
Hi, Patty, yes. Hi.
Thank you so much for doing this film.
It's my pleasure.
Standing up.
It's my pleasure.
We need more people
Absolutely,
like you.
absolutely.
Thank you. Let's talk.
Okay.
So why did you become a nurse?
I became a nurse after I actually went to school for nursing after I had my two oldest children. And I obviously, everyone I think goes to, if you're going to be in healthcare and work with people, I mean, everyone, it should be a given that you're in it because you want to help people.
So as a critical care nurse in the ICU for over 20 years, what are some unethical practices you've seen at the hospital?
They aren't centered around patients. They end up, it's more about hospital and their money and meeting quota, and that takes away from patient care, which ultimately is not benefiting the patient or helping the patient. Prime example, in ICU, we would have patients that, what might be in there for a couple weeks to a month, I mean, some longer than that. And, I worked in a trauma ICU, so these patients, after car accidents, they'd have, these horrible fractures, long bone fractures. They were on a ventilator. We're taking out we're taking, some of them, had been addicted, to alcohol or drugs. And so they're going through withdrawal now, during all of this. And we're taking their catheter out because Medicare, Medicaid will not pay if if a patient develops a urinary tract infection, because they have the catheter in, If they have the catheter in, they develop this urinary or this infection, they don't pay. They don't pay the hospital. So that becomes all that they center. And that's, in every meeting, how many, of these infections were there? How many infections were, of these? And that's all that it's like, that's what they focus on. Nobody talks about the patient that, yes, but they don't tell you about all now their skin that basically is sloughing off because they're sitting in their urine because they're urinating everywhere.
So are you saying that a doctor would not treat a UTI because it's not covered by insurance?
Well, it's not just the doctor, it's the units themselves too. So what I'm saying is that a doctor will do everything in his power to not let the infection occur with that catheter in. So their mentality then turns to, we'll just take it out.
But it's not about the care of the patient, it's about the reimbursement.
Correct.
Yeah.
Yeah. We're taking the focus away from the patient, and even though no one wants to say that, because that's the truth, no one wants to say this, but it is the truth. That's what we're doing. At the end of the day, we're caring for a patient based on basically what somebody behind a desk has determined is they see, there can't be more than this. If this happens when it's in the hospital, then you're not paid for it. So obviously the hospitals want paid. So what do? Then they make that the center of what the care is surrounded around. And so, insurance companies, Medicaid, Medicare, they have a part in this. Whether they want to admit it or not, they're driving this for these hospitals and for what the physicians and the nurses and administration end up making, the peons that are just, taking care of the people, they're driving that force. And that's where a lot of nurses and even doctors become conflicted because they don't know, it's like they know it's not what should be number one, but at the same time, this is what is being all that's talked about. You go to your meetings, this is what they're bringing up.
Why do you think doctors and nurses are going along with these mandated protocols and listening to the administration tell them, what's reimbursed, what's not, and treating or not treating patients according to these protocols?
I think there's a few different things. I think one thing that sticks out for sure is they think that this is just how it is. Whether you're a new physician, a new nurse, and this is what it's surrounded around when you come into it and you don't know any different, you just kind of go along with it. You don't even think twice. You need your paycheck. And unfortunately, it's even hard for me to say that. It's hard to stomach. They just seem like they somehow block it out, and I to be honest with you, I know I did do that for a period of time, but once that's where I draw the line. I mean, once you actually know what's going on and you understand it and you just keep going about it it's just another day, now you are a part of it in a negative way. That's the way I feel.
So we've talked about, some of the deadly protocols, some of the insurance driving treatment or lack of treatment, but what are some other things that you're seeing that maybe they're not bringing up that foundationally, patients need, but hospitals are ignoring?
Number one thing I would say is vitamin D. There's been study after study after study proving the benefits that you need vitamin D.
Are you talking about D3 or D2?
I'm talking about D3. D3 is what the human body needs. What most physicians prescribe is D2. They don't prescribe D3, they prescribe D2. That's what you can get at a pharmacist. When I brought this to a hospital administrations, I met with him, sat down with him, explained this to him. I said, why then are we doing this? Why are we putting people on D2 when we know it's not helping them? Why would we do that? We looked at each other for a moment, and this is someone I very much have always respected. And his response to me was, "It's not lucrative enough." Those were his words, not mine. Those were his words. My heart about sunk into my gut. I mean, that's hard to swallow.
How can you challenge your colleagues, nurses and doctors, to stand up?
For, my colleagues, nurses, physicians, for you to just ignore it, for you to just pretend like out of mind, out of sight, out of mind, that's unacceptable. And it is there's way more to all of this than meets the eye. I now know the truth, and there's no going back. I can't just pretend, because if I did, then I'm just as bad as they are.
Aslan, it has been so nice talking to you
as well.
today.
You as well.
Thank you for what you're doing with patients and how you're standing up, and other nurses need to stand up like you are. That's what we need.
And that's what I hope comes of this.
And there are nurses standing up, and
Yes.
we're appreciative of them.
Yes.
But we need more.
Yes, we do. We do. We need more. And
Yes.
physicians.
Yes. Aslan shared a lot of interesting points. Why is there a lack of care? Why are doctors and nurses choosing to stay even when the truth is right in front of them? Why are people just going along with it? It's because of the narrative that hospitals, the government, and the media have been feeding to people. They have taken great steps to control the story and really control every aspect of our medical system. They don't care about the patients, they just care about the money the patients bring to their pockets. They will do whatever it takes to control the narrative. This leads to families losing loved ones to greed and corruption. Erin Rettig is a mother who sadly experienced this in her family. She agreed to meet with me to talk about what happened to her son. So Erin, tell me about your son Daniel.
He was just a really all-around, really good boy, a good young man. He was very involved in his community. He worked with the veterans. He would go to Washington and fight for the veterans for housing. He was financial consultant for the housing, and he would work diligently for the veterans. Him and his children and wife would go and put flags on the cemetery on Veterans Day. They just did a lot. They were very involved with collecting coats in winter for them. And Daniel was just extremely involved with his community and his company.
Awesome. So tell me about when Daniel got sick.
I got the phone call and I flew up to Kentucky, the first flight I could get out. And when I got there, I was talking to his doctor at his kitchen table, and he told me the medications that Daniel was on. He was on 5 or 6 different medications immediately. Daniel had never been on a medication in his life. He was just really healthy. He had never been on anything. And so when I heard remdesivir was part of the medication, I said to the doctor, they signed something when they went into the hospital, please take him off the remdesivir immediately. At that point, they had to use a machine to turn him because keeping him flat for his lungs started filling up, kidneys started closing down. It was all the remdesivir. And when I went in there, finally had gotten his script filled because the doctor did give him ivermectin. And I brought the ivermectin, I handed it to the doctor, and I said, please give this to my son. This is prescribed to him. This will work. Will you please just give this to my son? It worked for my daughter and my grandson. He said, I know that ivermectin works, but my hands are tied. Where is the team? Where is the team at the hospital anymore? Where is the freedom of choosing what medications to try? My daughter-in-law had power of attorney before she walked into that hospital, notarized. She knew, and so she had that. And they absolutely ignored everything that she said, everything. At that point, they said, would you like to come in? We're resuscitating him. I said, you did not let me in for 11 days. You had not let me in to see my son once, and now you want me to come in while you were in, no. And I took my mask and I walked out of the hospital.
There's so many of us who've lost loved ones, and they can't even talk about it. And it's hard for us too.
Yes.
but we have to do it. And other people can do it just like we're doing. And we have to say, enough is enough.
Enough is enough. Enough
We're not
is
doing
enough.
this anymore.
No, we have, we need our freedom back. We need our medical freedom back. It has been stripped from us. We do not have a choice in the hospital. The end. We don't have a choice any longer. And then when my daughter-in-law went to pick up the medical records, the lady who was there said, I am filling in. This is not my hospital. This is not my normal position. I am filling in. I'm giving you this box of records for free. She said, normally we charge per page. She said, they are killing people at this hospital. Please do something about it. If there's anything I can do, here is my cell number. Why would a hospital worker even hand us her cell number unless something were happening? There were 7 codes that night in the hospital. 7 codes right in front of us. All hands on deck, running to every room, all over the place. They were all vented. We were right across from the nurses' station, so we heard a lot of stuff going on, a lot.
Erin, thank you so much for taking the time out today to talk about Daniel and his life and how he was murdered.
Thank you.
And I'm really sorry, but we have to stand, don't we?
Yes, we do.
We have to share their stories,
Yep.
and we have to be brave, because this is hard for us too,
It's
So
hard.
thank you so much for
you.
coming
Well,
today.
thank you for doing this.
It's sad to say, but Daniel is just one of hundreds throughout the country who have fallen victim to these hospital protocols. I came across a video of a man named Ray Hamilton. He spent 25 days in the hospital and did not make it out alive. 5 days before he died, he made a video to let people know what was happening to him.
I just want to say what's going on. When I got in this hospital, I laid here for 3 days telling them that I was losing circulation in my leg. I was ignored for those 3 days. By the time they got to my leg, I had lost circulation in it. Now it's most likely that my leg is going to be amputated before all this is over. But they've also let me lay here when my wife was asking them about a perforated bowel. I just need people to know what's going on up here. They're not noting things that they're supposed to note. They're telling me they're going to give me stuff that I haven't been given. The doctors are not noting their stuff. The communication is awful. Some investigating needs to be done because there's people dying up here for no reason, I think. And I'm afraid I'm going to be the next one because now I got to go to emergency surgery. Don't let somebody else lay up in here like this and hurt and go through all that they've been through and not do nothing about it. Come to find out, all this could have been prevented if they just listened to me to begin with. But I just want to let y'all know what was going on. Thanks.
I am so sick and tired of hearing stories about victims who were killed because of these ridiculous protocols. They are using fear and manipulation to make it seem like they know what's best for us, when in reality they're just trying to keep their cash flow coming in. They tell lie after lie to cover their tracks and pretend like they care about us. They keep saying things like, the FDA hasn't approved of certain medications that could help. The ventilator is to help your lungs rest. If you're vaccinated, you won't be hospitalized and you won't die.
You're not going to get COVID if you have these vaccinations.
And the list goes on and on. Lie after lie. But I'm happy to say that there are many doctors and nurses throughout the country that are speaking against all these lies. Gail McCrae, a nurse from California, has been trending online about her stance against the medical establishment and how they are lying and not properly treating patients. I set up a meeting with her in Tarpon Springs, Florida, to hear her side of the story. So tell us your name, where you're from.
My name is Gail McCrae. I was born and raised in California in the Bay Area in a little town called Santa Rosa. We're about 50 miles north of San Francisco. And I got a job with Kaiser Permanente in Santa Rosa. I was working primarily on the telemetry floors there as well, trying to transition into mother baby, but it didn't quite happen. I still ended up going to graduate school while I was there working in the telemetry floors, and I was in graduate school when COVID started.
Okay. So how many years have you been a nurse?
I graduated in 2011, so I practiced for about 10 years before I left the field.
Okay, so that was my follow-up question is, are you still practicing nursing?
After witnessing what I saw happening in the Bay Area Kaiser hospitals, I don't think that I could ever return. I felt very traumatized by what I was forced to engage in, and I don't feel comfortable going back to it. If anything, my goal now is to pivot and rebuild. I would love to see a new healthcare platform where we can start to actually integrate real healing instead of giving people medications which are generally a Band-Aid treatment to treat a sign or a symptom rather than the true cause of the illness or disease.
Tell me about, you just mentioned earlier you had some trauma during those times. So tell me a little bit about that.
Not only was I in the hospital and I saw, for instance, when the media was saying that our hospitals were all full, I was getting canceled because there was way too many staff and there were no patients. So that right off the bat was a big warning sign to me that something was wrong. And when I would talk to my colleagues about it, oftentimes there was just a big disconnect. I think that there was so much fear around COVID that people weren't able to even open their mind to the potential of what the real situation was in the hospital, because it was just 24/7 bombarding with fear-mongering. Lo and behold, after the hospital being close to empty for, over a year during the first year of this COVID pandemic, within 2 weeks of the rollout of the injections, my hospital saw a 3-fold increase in hospitalizations. And that was directly reported to me by my manager who was looking at the data. I can't find that data anywhere. I have hunted high and low for it. And I found the graphs online and they're literally empty. There's an empty graph. So the information is not being made available.
And then tell me about the hospital documentation regarding vaccination status. Tell me about what you had to do there.
One of my colleagues, who she was the nurse who manned the vaccination clinic for the COVID shots, she was told by her direct manager that if she reported a single adverse event to the VAERS database, she would be fired.
Wow.
And she is one of several nurses who I have received that report from. I was there working on the COVID floors and on the telemetry floors, and this was confirmed by nurses all over my county. The EPIC systems, the charting systems that we do our documentation in, EPIC had set those up so that nursing staff could only document in the vaccination status that the patients were either unvaccinated or that their vaccination status was unknown. So when a patient came in and they were diagnosed with COVID, we couldn't put in there that they were vaccinated.
They were altering,
facts.
what we need so we can be safe, right? And that's just one thing.
So they were scaring the staff, the hospital staff, into not upholding their oath. We took an oath to do no harm. We were being attacked if we dared try to report the truth of what was going on. And so most nurses just didn't.
Were you in shock of what you were seeing with your own colleagues? Was there doctors you respected and nurses you respected and it changed for you? What did that look like?
Absolutely. Yeah, I was blown away. And I think that's really what delayed my action for as long as it did, was the shock. People say, oh, well, you were just too afraid to speak out sooner. It wasn't the fear, it was shock. I just couldn't believe what I was seeing. I couldn't believe that I had colleagues that I thought, were critical thinking people that were watching these things happen. And if I brought it up to them, I would just get glazed eyes. And you know, people wouldn't want to share the break room with me because they knew I wasn't vaccinated. And, you know, it was really just mind-blowing to watch.
I mean, you have the do no harm. You have your practice act that you need to follow. And how does the government jump in there and get in the way of that?
It was
right?
really fear. It was really fear-based. All of those reports 24/7 with the news telling us that COVID was so extraordinarily dangerous, the staff were deeply impacted. The moral ground, when you choose to go against what you know is true, you give up a part of your soul. And that's something that I think a lot of these practitioners don't really understand. I see their light go dim when they choose
That's what I saw.
to go against what they know is true.
Thank you for standing up and speaking up and saying it's not okay, but we have to do more. We have to get some of these questions answered. And we have to see the whys and whos and the who told who what, because it's still happening today. We're just not hearing about it as much, but people are still dying today, right now. And they're still being isolated, and they're still giving the same treatment, and they're still being given a lot of money for it. And we have to stop it. So I'm gonna keep asking questions.
Thank you.
Thank you. Gail is one of many nurses who have put their career and reputation on the line by speaking up against all the corruption. Another nurse who has taken a stand is a woman known as Nurse Erin. She went undercover to record and document all the things that were going on in her hospital back in 2020. We were able to set up a phone call with her to get some of her insight.
Hello.
Hi, Erin. It's really good to talk to you today.
Hey, Patty. Thank you so much for calling.
I think what we're trying to get answers. We're trying to figure out all the whys, and we know some of the whys. It's money. But what are some things that we can do now?
People have to be their own advocate, because as a nurse on the inside, I wasn't even able to advocate for my own patients despite wanting to do the right thing. So our hands are tied, from the inside as well. I mean, you may have, a good nurse during the day, but what happens if you're going to get, what is your night shift going to be? So the congruency inside these hospitals it's the luck of the draw for patients.
That is a good point, because even for my husband, in the 4 weeks he was there, I mean, barely I saw 2 or 3 of the same person. And they were all contractors or travelers, so I mean, the consistency of care, the follow-up, knowing patient day after day, or at least 3 days in a row. It used to be that way, didn't it?
Yeah, I mean, if you were, the norm is to, be assigned to the same patients. But what they did under the guise of public health, they used public health and they used fear in order to push whatever they feel. So in this case, kicking family out of the hospitals, or kicking a patient's advocate out of the hospitals, and then placing gag orders on the staff, that is a recipe for disaster. And that's never happened, and it should never happen again. Here's the thing, even patients, that I've spoken to after New York, and have been advocating all over the nation, actually, in some cases across the, continent, they're very, very good at making patients feel like they don't know anything, or talking down to them, or, you need to listen to us because, this is what we went to school for.
I got that big time, yes.
It's wrong, right? They're making you feel like you are nothing and like you don't know anything. But and even as a very young nurse, what I always used to say to my patients is, you know your body better than anyone else. You've lived in it your entire life. And I would say that to, I worked in pediatrics for a little while, and I would say that even to the parents, like, you know your kids better than anyone else. You made them, you've lived with them, you've raised them, you know the certain things that they do. And that all went away. You know, they took away a patient's identity. You know, you remove a patient's clothing and you put them in these gowns. You like now, you know, like just that in itself. I mean, I know how I feel. If you have to go to the doctors and get in these gowns, like you kind of lose your a sense of your identity. And that's the whole thing. They stripped away identity, and then kind of made the staff assume that every single patient was just going to die anyway, and these were the protocols, and, you know, there's no liability. They were getting away with everything. So honestly, my best advice for people is to have a plan, have a good set of trusted people that in case of an emergency, you can call. I'm talking, you need to have a nurse advocate. You need to have an attorney. You need to have family members that have, you know, your wishes, you know, printed out and have all of that stuff ready to go. You have to hold them accountable, and you can't allow them to make you feel small and like you don't know what you're talking about. Because you have a right to autonomy, and you have a right to say no. You know, you pay them, they work for you, and just, you know, kind of remember that. So let's just say, for instance, you do have an emergency and you have to go to the emergency room or urgent care or whatever. And one of the first things that they do is, you know, ask for your ID, your insurance, and then they have you sign in. And that's what they're calling it, you know, like sign in here. And they're having you sign an electric keypad. Well, what they're not telling you is that what you're signing is consent of treatment. So this is like, you're essentially consenting to any treatment that they deem necessary for you despite your wishes. And that includes, you know, medications, that includes vaccines, that includes, you know, whatever they think is the best option for you. It removes your voice, and it removes any other, you know, wishes that you had in place. What people need to do is, you know, just kindly let them know that you're not comfortable signing that keypad, and to have them print out the information for you. And they still have to treat you despite not signing that if you want to take some time and go through it. And what I suggest is doing that. So you read it and you cross out everything that you don't agree with, and then you initial it, date it, and you can, you know, even write in little notes that I do not consent. That's what I usually do. Make it very, very clear to every single doctor treating you, every single nurse treating you, that, you know, you know, didn't consent to any of the items on the printout, because they automatically assume that everybody is the same.
Exactly. That is the point. It's protocols. So, Erin, thank you so much. I think some of the things you shared today are crucial, good pieces of information to give people to empower them before they're sick, because we need plans before we even get sick, you know. So thank you so much for standing up and keep standing up, and we're going to keep asking these hard questions and standing up for change.
Thank you so much, Patty. And honestly, I appreciate everything that you're doing. Every single voice is powerful, and yours is especially, you know, you're saving a lot of lives, and I'm so glad to be in this fight with you. So God bless you, and I'm here if you ever need anything.
Thank you, Erin. Appreciate it. I have spent so much time online researching, reading articles, and watching videos trying to get a better understanding of what or who have been driving these incentives. I came across a man named Curtis from Arizona who lost his wife Tammy to all this madness. He's been on many platforms sharing his wife's story, and he actually agreed to fly down to Florida to meet with me. His wife went into the hospital with pneumonia, but it was treated for COVID even though she never tested positive. I'm curious to hear what he has to say about all of this.
Tammy and I met when we were 19 years old, August 1983 in Vancouver, Washington. I was a young man in my muscle car. It was a 1971 Camaro, and I was cruising what we used to call the Strip in downtown Vancouver, Washington. And her family, her mom and dad, were exiting a restaurant. And she was with one of her friends. Her friend whistled, and I looked over and saw Tammy. Didn't notice the friend, but I said, stay here, and I told my buddy, if she's still there, I'm pulling over. So I went around the block, came back, pulled over. From that night on, in August of 1983, we were never separated until this occurred in January 20 of 2022. You know, telling her story and sharing her experience in the hospital and what we faced during that period helps expose some of the tragic events that people in much higher power decided was the best way to operate, even though it didn't align with us or her. I think these stories are tragic. Unfortunately, mine is not uncommon. There's way too many of them, but it tends to sit in an echo chamber. And it feels good, it's therapeutic a little bit to get through it, but at the end of the day, we need to pivot and have a transition, and chasing particular lawsuits and all those things are super important for some people where that is, something meaningful that it's tangible. But for the most part, what we really need to do is try and expose how we got here so it never happens again.
Take action.
Take action and figure out why we're still doing it. There's people dying today that are still operating in the same exact formula that we started with. Tammy didn't have COVID. She never tested positive, not once. And in a 15-day stay in the hospital, she went in with a respiratory challenge, diagnosed with pneumonia, tested negative for COVID. 15 days later, she's no longer here. The night of day 14 in the hospital, 2 a.m. in the morning, I get a call from the nurse that's on charge. And she says, we need to do surgery. Those are basically her first words. Mr. Bay, yes, this is so-and-so. We need to do surgery on Tammy. So I call my boys and tell them that what's going on. They have to do surgery on Mom. And so I say, meet me down there. They meet me there. It's about 3:10 or 3:15 in the morning on the 15th day, on the 20th. The surgeon says that she has something leaking in her cavity. Now, that's what I heard. So I don't know the specific medical terminology, but what I know from the toxicology and the forensic autopsies, she had a hole in one of her organs and it was leaking into her cavity. So I hear this and I'm thinking, well, you didn't clean out her bowels, and I don't know what you've been giving her that could have deteriorated her organs or whatever. So I'm frustrated but scared, really have no control, asking for clarity around some questions. He says, look, I need to do surgery, but if I turn her over, she'll stop breathing. So I can't do the scan that's gonna show me where the surgery needs to happen. So basically you should just say goodbye. She's not gonna make it. She's either, if I turn her over, she dies. If I don't do the surgery, she's gonna die. So my boys and I, we prayed, gathered our thoughts. They left, went upstairs, walked out in the parking lot together to try and figure out, how to navigate this for themselves. And I stayed there. I went in the room and stayed with Tammy. And it was the last time I got to smell her hair. It was the last time I got to feel her skin. It was the last time I got to kiss her. There was no more. A few minutes later, she was gone. This whole experience didn't have to go this way. This could have been handled completely different, but because there were choices made at a different level about how people would be treated upon admission to the hospital, and all the rights you give away by signing this admission, power of attorney, all these other things, Tammy never had a chance, and they made sure of it.
Curtis, thank you for sharing. I know that has to be super hard to go back to those moments of her last days. So let's go sit down and talk about that.
Love it. Thank you.
So Curtis, let's dig a little deeper into what's going on.
There's a ton of issues that arose and continue to arise with everybody that goes through this, right? There's a sort of a formula that the hospitals adopted early on of isolation, a particular medication treatment, a particular standard of care, if you want to call it that, the mechanical pieces of forced oxygen and ventilation. So yeah, the question is, for me, if I separate my emotions and my feelings of wanting to, hang somebody, revenge, all those sorts of things, it comes down to how did this get organized at such a large scale? How did the hospitals all of a sudden overnight change their business model? They needed an incentive. They wouldn't just change their revenue stream overnight if they couldn't replace that revenue stream. So questions like, who authored the incentive program? And that's a weird question, right? Because why would there be an incentive to move people through a particular formula of medication and physical care that really didn't help the patient? I mean, the numbers, according to John F. Kennedy Jr. and Dr. Corey and several other high-profile practitioners, say that the number of folks that died going through this protocol, if you would, or formula, because of the formula, were upwards of 50 or 60%. Why would you go along with that? And why would you keep doing it knowing that?
When did the government step in and tell us how we need to be treated?
Right, so exactly. So these meetings occurred at a very high level, right? So somebody decided this would be the drug, this would be the physical actions that we will take place once someone comes to the hospital. And if they, prior to them coming to the hospital, we want to force vaccinations.
Let's talk about the insurance and the billing and how that has changed over the last few years.
Yeah, that's actually a super interesting topic, right? When you look at the financial incentives that were given to hospitals to replace their old business model revenue, somebody had to guarantee the new revenue. And so you had a bunch of people line up that said they would do that. The first question is, where'd the money come from? But two, the insurance companies that lined up that said they would support reimbursement all agreed to reimburse at a much higher level than traditional reimbursement policies at the time. The largest carriers in the world are agreeing to reimburse the hospital at 120, 130, 150%. Why would they all of a sudden decide that they could spend that kind of money on this kind of a program where people are dying? Well, in the Wall Street Journal, they come out and talk specifically about not only the financial benefits that these companies had, these pharma companies. I mean, again, Pfizer did $100 and some billion just last year alone, and they admit publicly it doesn't work, but they benefited and they got immunity, and everybody that touched that got immunity. These questions have to get answered, and these may not be the most appropriate questions, and they may not be the exact right ones, but let's start having the conversation outside of the silo of our tragedy and our particular personal feelings about our loved one. Let's get outside of this and figure out how this was organized, who ran it, who managed it, and they did so effectively, so well that they're still doing it today.
I'm going to ask the hard questions. I'm going to find out, Curtis.
We've
got to find out.
We need you and others just like you to dive in and get after this, because it's not going to happen by osmosis, and it's not going to happen by us telling our same stories over and over and over on different podcasts and platforms. We have to elevate this conversation to a different level, and you're the right person to help do it.
We need change. Thank you for talking about your story, and we're going to do it for Tony and Tammy. We have to challenge our local leaders, our hospital boards, and politicians to change the way we go about health care. We need to move past just sharing our stories and move into implementing new policies. I'm grateful to have had the opportunity to talk with all these brave people who are not giving into the fear, but are calling out the corruption. They've taught us to think more critically and to do our research when it comes to prescriptions and medications. And the fact is that the COVID protocol is just one of the many things that need to be addressed within the healthcare system, such as hospice care, the world of special needs, and cancer treatments. This is not an easy path to walk, but God has given me the strength to keep moving forward. My faith in Him and His plan is what gets me up in the morning and gives me the boldness to fight for these victims. Take a moment to decide, how will you go down in history? When the fire dies down and the smoke clears, will you be found among the rubble? Or will you be standing amongst the brave?